Senator from Utah is recognized.
Mr. President, I've listened with some interest to the comments that have been made when I came on the floor. I simply want to make this one observation about Medicare Advantage. President Obama promised that Americans who have coverage that they like would not lose the coverage that they have. There are a number of Americans who have Medicare Advantage and they like it and they want to keep it, and this Congress is about to say, no, you can't. This Congress, through this bill, if it passes, is going to eliminate Medicare Advantage, and frankly, the people who go after Medicare Advantage because they like it are going to be the ones that are disadvantaged here. They're going to be the ones who will see President Obama's pledge violated, and frankly, I don't think they much care about how much an executive is paid or what happens in the company. They care that they have coverage that they like, coverage that they're paying for, coverage that they have chosen, and they're being told by the federal government, you cannot have what you want. Now, there's another aspect to this that I'd like to explore in the time that I have. We keep hearing so much about the CBO and all of the scores that the CBO is pointing out, along with rhetoric that says we can't afford to wait. We need a solution now. The status quo is unacceptable. I'd like to point out once again that the status will remain quo for 4 years if this bill passes. In the budget smoke and mirrors that have been put into this bill, and in order to make it look as if it costs less money, they make the effective date in 2014. So there will be 4 years after the implementation, after the passage of this bill, where Americans will not see any kind of change in their plans. But what they will see is an increase in their premiums. They will see an increase in taxes. Why do I say that? Between January of 2010 and January of 2014, there will be 4 open seasons in which plans can be changed. And as the taxes start to hit, as the costs start to hit, those companies that are involved in offering these plans will say, okay, we've got to get ready for the expenditures. What do? We've got 4 open seasons in which to change our plans before this thing hits. Now, obviously that cannot be scored by CBO because CBO doesn't know what changes will be made. But do we really think that we can go through 4 open seasons with no change whatsoever in the face of this enormous change that will hit in January of 2014? Do we really think everything's going to remain static? That's what the CBO computers are. And do we really think that the $500 billion that they want to take out of Medicare to help pay for this will not be hashed over again and again? One of 2 things will happen. Number one, the Democrats will blink in the face of the anger of senior citizens and say, we really didn't mean it. Yes, the bill cuts Medicare by $500 billion, but we really didn't mean it, and we have 4 years in which to fix it. That is, 4 years in which to replace that $500 billion. And of course, when that $500 billion is replaced, if that's the way they decide to go, then we will know that the numbers we are getting out of CBO are completely phony. Then we will know that the statement that this bill is revenue neutral is a non-starter. Then we will know that there was never any intention to try to deal with this cost. But suppose future Congresses stand firm and say, yes, we are going to stand firm in this 4-year period. We're going to stand firm against the anger of the senior citizens who are seeing their Medicare benefits get cut. And we're going to take the $500 billion out of Medicare. Then we will see the promises that are being made around here that there will be no cut in Medicare services all disappear. I hear people say, we're not cutting benefits, we're just cutting payments to providers. That statement is being made over and over again on the other side of the aisle. We're not cutting benefits, we're going to take that $500 billion away from the providers. but the benefits will remain the same. Well, Mr. President, in my state, I have plenty of providers that are on the edge right now, financially. They're on the edge of going out of business right now, financially, because of the cuts that have been made in Medicare in the name of cutting down payments to providers. What happens to the people that are in a nursing home that is currently dependent upon Medicare payments in order to survive if they come in and say, all right, we're not going to do anything to the benefits these people are entitled to in this nursing home. We're just going to cut enough payments to the nursing home that the nursing home goes out of business. And what happened to the people who are in the nursing home under that circumstance? Well, they're going to have to go someplace else. And there's going to have to be money to pay for them to go someplace else. And the money's going to have to flow through Medicare someplace else. And we're back to the first option that I talked about, which is we weren't really serious when we said we were going to take $500 billion out of Medicare. We weren't really serious. In order to make sure that you don't lose your benefits, we're going to have to start reinvesting in some of these providers. We've seen providers go out of business because of the cuts in Medicare. We need to start putting that money back in Medicare, and we're back into the circumstance that we've been talking about all along, that this thing is not paid for. One final point I want to make. We had a hearing today with the chairman of the Federal Reserve. Ben Bernanke is up for reappointment. And, of course, the entire conversation was about the economy and what is the future of the economy. There were a number of people who had conversation about the past, but I wanted to focus on the future. And I pointed this out to the chairman and asked for his comments with respect to the future of our economy. Most of my constituents don't understand what I'm about to say. Frankly, most of the people in the press don't understand it, and maybe some even members of this body don't understand it. When we talk about the federal budget, 2/3 of the federal budget is beyond the control of this Congress. 2/3 of the federal budget is on autopilot unless this Congress changes entitlements. Somebody says, well, what does this word entitlement mean? Why do you talk about entitlements? Entitlement means, by law, these individuals are entitled to this money whether we have it or not. The federal government has made a contract with them, all right, it's a social contract rather than a legal contract, but it's just as binding politically, where the federal government has to spend the money whether it has it or not. And indeed, that's what we have seen in fiscal 2010. The budget that we passed here said revenues are going to be $2.2 trillion and entitlement spending is going to be $2.2 trillion, which means that every function of the government, our embassies overseas, our troops wherever they may be, education, national parks, whatever it is, every dime will have to be borrowed in fiscal 2010. Every single dime, because every penny coming into the federal government is already programmed to go out without coming through the Congress. It doesn't go through the appropriations process. We don't get to vote on it. People are entitled to receive this money, and it's going to go out there. What are we talking about here? We are talking about creating a new entitlement, a very expensive new entitlement. And how are we going to pay for it? According to this bill, we're going to pay for it by transferring money from an existing entitlement. And anyone who thinks that's what's really going to happen in the face of the anger that is being generated by people who read about this believes a fairy tale. The whole notion of trying to balance the cost of this tremendous new entitlement by somehow a bookkeeping entry that says we'll take it out of the Medicare account and we'll put it in this account, and the computers who don't think, the computers simply compute, will say, well, then if you put it in this account, then this account is revenue neutral. But the government's account is not revenue neutral. This thing's going to cost $500 billion wherever we get the money, and it's a cynical ploy, smoke and mirrors of the worst kind in a budgetary bait and switch to say we're going to take this out of Medicare. So, Mr. President, I hear from my constituents, I hear from people who are not my constituents, who recognize me as a senator in airports and other places, as they say increasingly, do not pass this bill. We see it in the polls, but we see it in the passion of the people that come up to us and let us know how firmly they are opposed to this bill. The American people don't want it, and the American people are right. I yield the floor.